Good afternoon. Glad to be here with you as we've been doing every couple weeks for a while. And I am always glad to be able to give an update about what's going on in the county here with COVID as well as with the vaccines. And I know that's information that everyone is really interested in. So I'll start first with the numbers. Up to date, we have had 4,650 cases. And over about the last 5 to 6 days, we've had an average of 10 to 12 a day, which is much lower than it had been. And that I'm saying it seems to be a trend. I hope it certainly continues in that direction and becomes even lower. We only have 71 cases that are active, and that's also much lower than it's been for quite a while. 7 hospitalized, again, that's less than we have seen for quite a while. And unfortunately, though, we have had a total of 124 deaths. I want to tell you how many vaccines we've given, how many doses. At this time, first doses, we've given 1,511, and second doses, we've given a total of 348. So if we add those two together, that means we've given 1,860 vaccines. And today, my main focus is vaccines. There are several items I wanted to talk about, focusing on those vaccinations, the status of vaccine in the county, as well as the process that's used to get those vaccination appointments scheduled. There are a number of things that need to be considered that contribute to the amount of vaccine that we get on a weekly basis and its distribution. We know that vaccines the amount is still not meeting the demand. Therefore, that means that I would say that all the counties in the state are in the same situation that we are, wanting more vaccine for our citizens, but getting what is available to give us. And they determine that somewhat on our population. In fact, about 90% of the decision is made on population. And also they are making about 10% of that vaccine go to underserved areas that are not treated as equitably just because of location or some other factors. So that's how the vaccine is allotted for. We can ask each week for an amount that we want, but unfortunately that has not been the amount we've received every week. In fact, we've received approximately 100 to 200 doses a week since this all started. Some weeks receiving none, some just 100. One week we received quite a bit, which we did a large clinic with 3 weeks ago with that second dose coming up very shortly. And we have been blessed by many volunteers that have helped, and I really want to give a shout out to those volunteers. We've had students from Sentinel Career Center, the health profession students, as well as the public safety students who have helped us with taking calls off of the phone that we've received, messages that we've received. They've helped by filing charts that need to be filed that we just have not had the time to get to because of doing vaccinations, and also helping make some follow-up phone calls, reminders about when an appointment is scheduled. We've also had a community group that banded together probably 2 months ago, comprised of community members, and they have been super getting us volunteers, and we really appreciate that. We can use that help. We've had retired employees that have also come in. So it truly is a community effort, what is happening. One of the concerns, as I said, is that we are not getting that out fast enough. We are getting it out at least within a week. And we'd love to be able to do clinics all day, every day, but of course we still have the health services that we need to provide on a regular basis that health departments throughout the state have all provided for years. So if we received 1,000 doses a week, that would be pretty tough for us to get that out. Again, we would have volunteers that would come help, and we would figure out ways to do that. But you want to be very careful with the vaccine, how it's recorded, how it's allotted for, how it's prepared. So we also do not want to do it in a manner that's hurried and haphazard. We want to do it in a very systematic way. So that is one reason we may not get things out as quickly as you think that we should. Also, we've had the concern, we've been asking people to register to get vaccines either online by going to our website. You can also do that through the EMA website, or we do have a line dedicated to receiving calls from citizens. who would like to have their name put on a waiting list for the vaccine. That number at the health department is 419-447-3691, and the extension is 6355. That has recently changed with the new phone system. So there's a 6 in front of our extension numbers now. So that's 6355. And that line we exclusively use for getting those messages. We are leaving messages now. At first, we perhaps did not, but realized that people do like to know what they're getting a call about. And we had some issues very early on with the phone exchange where our number wasn't coming through. We did do a test, though, quickly yesterday from a number of different extensions in the building to find that when you get a call from us, it will be that 419-447-3691 telephone number. So watch for that if you have put your name on the list. We do leave messages, but unfortunately, we can't necessarily reserve a spot in a clinic for you, because what we often do is schedule clinics. Perhaps we're scheduling as late as the next day. And the reason we have done that, not scheduling clinics far in the future, is because of the fact that we sometimes do not know exactly how many doses we receive. We don't want to plan on a certain number of doses, schedule an appointment next week for that many people, and then find out we do not get that many doses and have to call people and cancel and reschedule. So sometimes it needs to be done very quickly, and we just don't have time to wait for that message to come back to leave that spot free. Also, we do try to give people a call who can be to the office in a very short period of time, within a half an hour at the longest, if we have doses that are left over, because after some clinics, we do get a few more doses from the vials than is expected. So that's a good thing. It gives us a little more vaccine, but also it needs to be used in a certain period of time, and that's the reason for doing that. Third, I also want to remind people that even though it's been publicized from the state level about the different categories when people are eligible, now we're down to 70 plus, but we still have quite a few people who are 80 plus on that list. So we want to get to those people first. So even if you are in the 75 plus age group, and that's due now as it's been announced, that doesn't necessarily mean that with the next clinic that we are going to be able to get you in. We'll do our best to get everyone in as quickly as we possibly can, because we do want to protect as many people as possible. It's really going to be key to getting our community and our lives back to that more normal state, or what we used to think is normal. And I think we're definitely moving in the right direction with seeing the cases go down, with getting vaccine. I'm hopeful that the manufacturers will be able to produce more, larger volume of vaccine so that we can get more. We also know that there are other vaccines on the horizon and may become available. So hopefully that will contribute to providing us with more vaccine on a weekly level. We are, like I said, we're moving through our list by age groups, trying to reach the oldest people on that age group first. And so even if your name is ahead of an 80-year-old, if you're just 65 age range, you may not get your call before that person who is 80 does, because again, we're working with the most vulnerable populations first. One thing that may slow things down a little bit too is the fact that last week, schools were added, school staff, teachers and staff were added to the priority list. So all the month of February, that is another focus of groups that we want to reach. The governor has mentioned many times, had experts on his press conferences talking about how important it is for our students to get back into school. So that's going to be key in helping schools get open and stay open. So that's something I know everyone is looking forward to. So please, I just ask that you bear with us, and we will do the best we can. And if you by chance get a vaccine at another location and you had put your name on our list, we would ask again that you call that number with that dedicated line and just give your name, say, I've received my vaccine. At this time in Seneca County, we do have 4 other providers, and that includes Mercy Hospital, includes both the Kroger facilities here in Tiffin and in Fostoria. And then I noticed just added when I got my list today, the Community Health Center on Seneca Avenue. I did try to give them a call this morning, but they were so busy, I did not get a person to speak with. I wanted to ask what their process is, but I will try to find that out and we can post that on our website and let you know what that is. Mercy has a number that they ask you to call, and then of course Kroger is doing it online. So just bear with us. We'll do the best we can, more than the best we can. One of my nurses said yesterday when we were talking about this, we'll try to do better, or we're doing as well as we can. I said, no, you're doing better than you can. They really sincerely want to do their best to get the vaccine to our community and help keep more safe. So now I'll turn it over to John Spar with the EMA, a partner that's been a big help. And John, I'll let you take it from here.
Thanks, Beth. I don't have a whole lot to add to that. I just want to remind people they can go to SenecaCountyEMA.org. That's our website for the Emergency Management Agency and Emergency Services for Seneca County. There's lots of information there, but it pops up right away. You can go to our COVID-19 page and find information and registration forms. It'll take you to it's a link to the same form that is on the General Health District's webpage. So you can go to either place. You're certainly welcome to give me a call if you are having trouble or are not sure whether you got registered, and we will take care of you. We'll get you registered. If you don't have access to a computer or that's not something you're comfortable with, feel free to give me a call and I'll get you registered for your vaccine. Not much else to do except it's easy to forget that there's other things going on. Pay attention to the weather. We're in our cold weather snap right now, and keep an eye on what's coming up and make sure that you're prepared. You, your family, your neighbors, and your pets are prepared appropriately for what's coming up. If you have any questions about the weather or anything preparedness wise, feel free to give us a call here at Emergency Management Agency of Seneca County. Unless there's any questions, that's all I have.
Awesome. Thank you, John. So yeah, we'll go ahead and open up now to the questions. I made it so you guys can unmute your line. So if you do have a question, you can unmute and come forward now. Just please state your news agency and your name before you ask your question.
Hello. Mike
Hey.
from NBC 24. Can you hear me okay?
Yep, go ahead, Mike.
Have we had any issues in Seneca County getting shots to the people that need them? Like Lucas County's been having issues. My mother, in fact, is 77, and she was scheduled for a shot and then was for some reason removed from the list here in Lucas County. Are you guys in Seneca County having those same issues?
As far as the health department goes, luckily, no, we have been able to serve those who we have scheduled for appointments, plus a few more. As I said, we have people who can be there in a matter of a few moments to get their shot. We put them on a reserve list so that we can give them a call. As far as other counties go, I'm not sure if you're speaking of through the health departments or through the other entities. And I honestly do not know here in Seneca County if the other providers, if that's been an issue.
Thank you.
Great. Thanks for your question. Vicki, go ahead.
Hi, I'm Vicki from the HE. Someone told me that CVS has vaccine. Is that, do you know about that at all?
My understanding is I know Hancock County CVS did, or Findlay did.
Oh, okay.
I don't believe that if anyone from CVS is listening and knows, please correct me. I'm thinking that I've not seen that they've received any yet here in this, at least on our appropriation list that I received this morning and looked at. It did not have them listed as a provider here in Seneca County yet.
Okay. And do you have any total number of people who have been vaccinated so far?
Yes.
You mentioned it earlier, but I think
I do just our numbers at the health department, which again
okay.
is a total of counting second doses, 1,860 total vaccine doses have been given out. 1,511 first dose, and then 348 second dose.
Okay, that's what you said earlier. You don't know the number other ones then, like from Kroger?
I'm sorry, I do not.
Okay.
No
No problem.
I'm sure that they have gotten them given just about as soon as they get them. I know that.
Mhm.
Vicky, this morning when I went to the state's vaccination page and their, what do they call that? There's a graph and you can choose the county or click on the county and it shows
Okay.
you about the vaccines. There was a number there for total vaccinations given in Seneca County, total, which means long-term healthcare centers, which we haven't been, they're not tracked on ours.
Okay.
So that number is available. I don't know what the active date of that is, but it was I'm not going to quote the number because I can't be sure of it right now, but it's
I can go look it up.
available. Yep, it's available on their vaccination page.
Okay, and that's fairly up to date then, you think?
I don't know when the last update was. I
Okay.
couldn't tell you that.
All right, thanks. I'll look at that.
We do have to enter the data into a system that then uploads to a program called Impact Sys, where we have been recording vaccinations for years. But some different entities have different types of data software that they put those into. Some load directly into that. Some have one set of software they use and then upload it into that. So I know sometimes there's I know there is a delay. They ask us to get that in within 24 hours, which if an entity is doing a clinic with 1,000 people or so, that's pretty tough to get that all entered in. So there is a lag time. What it is, I don't know for sure though.
And I'm just going to say, because I looked it up now, according to that website, it gives you the statistics for vaccine started and also for vaccine completed. And according to their website, as of now, the total vaccine started for Seneca County is 4,504, which is about 8.2% of the population.
Yep.
And I'm going to actually switch over to vaccine completed, which I'm assuming, Beth, that's because some of the vaccines, there's 2 shots to complete.
Right, that would be the reason.
And so completed is 1,514, which is about 2.7%. And you can find that if you go to coronavirus.ohio.gov and then click on the COVID-19 vaccine dashboard. So it took me a second to get to it, but you guys can check that out for yourself to get that official data. And actually, are we good on that topic? Can I move to the next question? Is that okay?
Thanks, Jimmy.
Yeah, hey, no problem. We can come back to you, Vicky, if you have anything else, but I see that John Monk from W2L has his hand up. So John, you can go ahead and come forward and ask your question now.
Thanks, Jimmy. Hey, Beth, a question for you. One problem that we've had locally in the Lucas County, Wood County area are people who are trying to schedule a loved one's appointment on their behalf. Like my wife was trying to get her great grandmother scheduled, had a lot of hoops to jump through with that. Could you talk about the advocacy of people being able to call you guys directly on behalf of an elderly family member who may not be able to do it online or do it themselves?
We have been taking those calls, and I know that I've pulled calls off, and many times I know have calls that they say, this is so-and-so's daughter. I want to schedule an appointment, get her on the list, and would you please call my number? So for us, that has not been a problem as far, I don't think we've really seen anyone abusing that at all. So I would say that we've not had an issue here as far as I know.
Okay, that's all I wanted to know. Thank you.
Yep, thanks for the question. And I can say too, just from looking at the Facebook messages that we get, I mean, we're trying to make it as easy as possible for people, even with limited resources and time and staff. So when someone reaches out and says, hey, I'd like to see if my grandparent is on the list, we've been able to verify that. The problem is, I think that as we've talked about in this press conference, there's a limited quantity of vaccine that's coming into the health department each time. And the list is much, orders of magnitude larger in quantity than the amount of vaccines that we have or doses that we have. So that's kind of the biggest problem. So are there any other questions from any of the members of the media here on the call?
I thought of another one, Jimmy. This is John Monk again.
Yeah, go ahead.
Beth, do you have any semblance of a timeline or a roadmap maybe for when we can expect to see these rural counties getting a larger amount or larger shipments of the vaccine?
I believe as the vaccine companies begin to increase their production, we'll see more coming everywhere. And then we know with Johnson & Johnson that's just now being approved, getting that approval, I would expect that we can see an increase in all counties, would be my expectation. When? I don't have an answer to that.
Okay.
That's the $1 million question right there. And, you know, one thing I do want to mention sort of related to that is, yeah, I think we're definitely facing this challenge in rural counties, but I also think it's happening everywhere. It's not just rural counties. You know, one thing I noticed from Governor DeWine's social media page earlier this week, he was saying that the state itself, the state of Ohio, was getting about 140,000 doses weekly. And, you know, there's 2.2 million Ohioans in phase 1B alone. So you can see it's a fraction that's setting up to take weeks and weeks, even just in phase 1B, which Beth, can you remind me, is phase 1B, that's the schools and 65 and up?
Schools, yes,
Okay,
yes. that's
but
cool.
we're in tiers.
And those with congenital disabilities, certain specific ones that they have named.
Great,
They-
okay. Vicky, I saw you had your hand up if you have something.
Yeah, I just wondered if you had any vague notion of when the 80+ people would be finished and the next tier would be starting.
I have a feeling that probably this week we will pretty much be finished with them, or at least into next week.
Okay.
I am hoping, yes.
That
They
gives
were
people
breaking
a
that.
kind of an idea anyway. Okay.
They were breaking that down. In fact, someone was working in that database just to get those to see just where we were. So I might have more information about that later this week too. I'll work on that.
Yeah, and any help that you all can give us, Beth touched on this a little bit. What I see on social media is a lot of confusion because the state says, hey, it's okay for people who are in the 65+ range to be vaccinated now. But because of the lack of supply, we're still working through mostly the people who are 80+. And so people get confused and they think, you know, my grandparent is 90 and they haven't been vaccinated yet. Why are you vaccinating 65-year-olds? And the answer is we're not.
We're not.
And so we need help getting that word out there. And so thank you all for kind of helping us spread that word.
I think the key word is registration, not vaccination.
Mhm.
And that's what gets missed in the postings. So we have to push that it's okay to get registered now, but it's going to be a while before you see a vaccine possibly.
Thank you, John. Yeah, cool. So are there any other questions here from anyone on the call? Okay. All right. I think we're pretty much covered. I'm just really quickly looking over at the Facebook, but I don't see any comments on there right now. I do want to remind everyone, if you're watching on Facebook, that you can reach out to us through the Facebook page if you have questions on anything that we talked about today. And also just, you know, keep an eye on local media, keep an eye on social media. We will continue to push out information as we have it. And I think, as John said, just we're really stressing, just be patient, bear with us. We're doing the best we can. And, you know, some of these things are not in our control, that, you know, the amount of vaccination, the quantity of vaccines that we're getting. So I'll go ahead and throw it back to Beth. If you want to kind of close it out and make a closing statement, and then we can call this thing good.
I just want to thank everyone that have joined us and like you to listen in so you can get the information. And the media has been great giving coverage, radio stations here in the county, the newspapers, online papers. So whatever way you get your news, look, and you should see something about vaccinations. Again, appreciate you joining us.